Good afternoon and welcome to the Cancer Education Series brought to you by MercyOne and Above and Beyond Cancer. We're also supported by the Iowa Cancer Consortium. My name is Chris Goodale and I'm the Executive Director of Above and Beyond Cancer. And it is my pleasure to introduce the founder of our organization, Dr. Dick Deming, who will introduce our speaker for this evening. Dr. Deming?
Thank you, Chris, and welcome everyone. And it is my honor to introduce our speaker, a colleague here at Mercy, Alicia Bohlke. Alicia is from Northwest Iowa. We were talking, I'm from a little town of 500 in Southeast Iowa, and she's from a little town of 600 in Northwest Iowa. I'm from Southeast South Dakota. She's from Northwest Iowa, but it's—
That's right, I forgot, yeah.
Not too far, and we both live in little towns where everybody lives on the edge of town. And we grew up with a family. She's going to talk a little bit about her background. Currently, she's one of my colleagues here at MercyOne in Des Moines, and she is the administrator for the group of doctors as Pulmonary and Infectious disease. But she has a passion that transcends infectious disease and lung diseases. And she's quite a musician. And we've asked her to talk about one of her passions, and that's music therapy. The title of her talk is Healing Harmonies. What is music therapy and what role can it play in medicine today? So I'm going to turn it over to Alicia. Thanks.
There. Thanks so much. Yeah, I forgot you were in Southeast South Dakota. Yeah, very nice, very nice. Well, thank you so much for asking me to do this. I have to credit Tim Hackbart too, because he's the reason I got in contact with you at one point. I was trying to meet people. I was new to MercyOne in September. And Tim goes, wow, if you've got a passion for music therapy, you've got to meet Dr. Deming. And I met you. It was fantastic. I think he lined that up in about 2 days and said, Dr. Deming wants to talk to you. And I'm like, oh, okay. Little pressure, just a little.
Yes, I can't remember if we sang a duet that first meeting.
We didn't, not yet, but we will.
Okay,
we will.
Good.
Yes.
I count on it.
Yeah, during this little spiel, you can be back there warming up if you want.
Great.
There's a piano right here next to me. So, and I've got some information on you too, so that's good. I appreciate it. I'm just gonna start in. I've kind of got an agenda and I wanted to give a little presentation. It has some PowerPoint slides that go with it. So I will get started. Okay, can you see that?
Yes.
Awesome. Yep. Very good. Well, that's what we're going to do. We're going to take a look at music therapy and its role in healthcare. I have a disclaimer. I am not yet a music therapist. Like Dr. Deming said, I've had a passion for music therapy for decades now, but my life, wherever it took me, just didn't seem to present itself an opportunity to do something about it. Now, here I am in my 50s. And I really wanted to do something. So I watched that video that was put together about the new cancer center. And Dr. Deming, you mentioned about music therapy. And I thought, wow, I really have to get to know what's going on here because this might be the opportunity. There's only one music therapy program that is a distance learning program at St. Mary's of the Woods. And so since it's in Terre Haute, Indiana, I am, now that I've moved back home, probably close enough that I could actually do this. So I'm going to do a little bit of science. I'm going to do a little bit of fun, and then we'll kind of talk about what is music therapy and what is a music therapist. So, like Dr. Deming said, this is a little bit about me. I went to Morningside now University. They've now changed their name to University in Sioux City. I had a double major in piano and voice, and then journalism. Two professions I didn't realize you could starve by taking. But I did anyway. And so I did journalism for like 16, 17 years between Iowa and Florida, mostly ABC stations. And then I moved out to California and I got into healthcare. And that's when I went and got my MBA in healthcare at Western Governors University at Salt Lake City. So I've lived in Florida and California the last 30 years and just moved back to Iowa in September to be closer to family. My folks are still alive and kicking in Northwest Iowa, and I've got 3 older sisters, so I have 4 mothers. My certified music therapy degree is in the works, and I'll tell you a little bit about that because there may be somebody watching that's interested in knowing how to do it as well. And I've done some research, and I'll share that. And then a little bit about what sparked the love of music therapy is that lady on the right. So that is Grandpa Ernie Piercy and Grandma Florine Piercy. My middle name is Florine, so I'm named after both grandmas. But you see how her hand kind of sits on the wheelchair there? That's the way it was placed all the time. She was always in a wheelchair as long as I knew her. So I think it was well over 25 years in a wheelchair. And when she would get nervous or anxious, have severe anxiety, that hand would just bounce on the wheelchair, the arm of the wheelchair constantly. But they had a player piano, an old player piano, and I've been taking lessons since I was 6 years old. My mom took care of those 2 every day, fixed them supper every single day of the week. So I would go out with her after school. And I would notice sometimes that grandma was a little anxious or having what we called one of her spells, and her hand would bounce and things were very tense for her. So I would just go over to the piano and I would do this. I come to the garden alone while the dew is still on the roses, and the voice I hear falling on my ear, the Son of God discloses, and he walks with me and he talks with me and he tells me I am his own, and the joy we share as we tarry there, none other has ever known. Just a little bit of music from my grandma, one of her favorites. And I turn around and find out that her hand was calm. There was a calmness in the room. She just felt better. My mom would sing from the kitchen. My grandmother might even hum along and sing along. It was a blessing. So I know there are other people that have had that same type of experience happen with a relative or somebody that they've known. And that's kind of where the basis of music therapy started from a long, long, long time ago. So music's universal. And when you see it have an effect on somebody who's having anxiety, pain, or stress, it has a calming effect for the most part. So that's where my passion came from, Dr. Deming. That's it. That's the lady right there.
That is beautiful. That is beautiful. Beautiful photograph.
Yeah, that was really fun. It was one of their last anniversaries together. So yeah, it was good to have them around. And my folks are going to be celebrating 69 years very soon. So wow. Yeah, very fun. So this is my little agenda for this presentation, just to give you an idea of what we're going to go through. Some music and memories, things that happen for everybody at all times. And then the science and music and the human body. What's music therapy? The science part, my kids said to keep it short, because they're all like, oh, please don't get into the science of this. So we'll do what music therapy is, the history of it, the multidisciplinary uses in medicine, and then what does it take to be a music therapist, in case there are others who want to do this as well. So this was kind of fun. I knew I was going to do this talk, and I thought, oh, what do I want to do that makes this a little bit fun and people can kind of think about how music affects them? Because we have it around us all the time. Sometimes we're not paying attention to that. But so I asked a few people that I hang out with, what were some of the songs that invoke a memory? So one was Careless Whisper by Wham, George Michael from the 80s. And that invoked memory of their first love. They remembered that one. I asked no more details after that because I don't want any more details, but it was their first love. So then the next one is actually my son, who's a submariner out on the West Coast. And I had him on the phone talking, and I said, hey, I got to do this talk. What's a song that kind of made you invoke a memory or made you feel something? And ironically, he said it was Hall of Fame. It's a song by The Script, kind of a rock band. And it said it reminded him of middle school and how he could have spent more time being social, learning how to create relationships. Because now that he's in the Navy, music is playing a big part because there's a lot of solitude in the Navy. So he kind of realized that he could have spent a little more time maybe creating relationships and using music to do it. The other person I talked to said Moonlight Sonata, the piano sonata number 14 by Beethoven. That just reminded them of a very scary piano recital they had when they were younger. I can attest, yes. Only threw up once before a piano recital, but there you go. And then I had somebody else I asked about, and they said, oh, I think the song that kind of reminds me is Working for the Weekend by Loverboy. I'm like, and that basically is self-explanatory because we're all working to the weekend, basically. So I don't know, Chris, I forgot to ask too, but if there's an interactive chat button, if there's a piece of music that kind of invokes memories to people who are listening, if they can leave it with you and we could talk about it later, that'd be awesome. Otherwise, it's just for fun.
Sure, they can use the chat box down at the bottom of their screen.
Okay, awesome, thanks. So this is a video, obviously, with no sound. And it loses something. It's a beautiful picture, beautiful polar bear, but it's missing something. So let's try a different one. Hopefully. Well, we tested this out. It worked great before. Of course it did. Anyway, that is a video that has a similar polar bear in amongst trying to forage for food, and it has some relaxing music behind it. I mean, it's not rocket science. Everybody knows if you go get a back massage or you want to relax for a little bit, you kind of put on some relaxing music, nature therapy music. There's a lot of different terms being used for that kind of stuff. But in this particular case, it was a similar polar bear walking around. But I'm going to skip it since it's not going to show up. Yeah. Okay, so the part that my boys told me to keep very short is the science behind music in humans. So basically, most of us pay attention to music around us almost every day. There's always some type of music. It might not be full-on songs, but it could be tones or pitches or things that you hear on a regular basis. So all of that is measured in frequency, and the vibration of matter is what produces that sound energy. So we pay attention to the vibration because that's basically what's producing the sound. Musical instruments rely on this, the vibration of air, to produce sound no matter what. Every single one of them has some ability to produce sound through air vibration, and that's what we call music notes, per se. Again, the frequency that we measure is called hertz, and that's just for the next slide. So sometimes if you go to the symphony, you're going to hear somebody say they're tuning. I used to play for a symphony. We need an A, or they're just a small quartet. They're tuning. They're going to sing with the choir that I'm playing for. They'll say, give me an A. And what they really want is that they're going to tune to an A, the concert A. And that's how we start matching frequency, pitch, tone. They want to be a good blend on their instruments. And every single string instrument has an A string, which makes that beneficial because that's where we're tuning to. So that frequency of that open or that concert A is 440 hertz. And the first violinist is almost always, but that's the person that they go to in the symphony for an open A. He'll play an A, he or she will play an A, and then everybody else can tune to that. Why does that matter to us? Because it has a direct effect on our bodies. We actually feel that vibration because we're paying attention to the timbre and the tone and the pitch. Sometimes you hear a singer and you're like, ooh, that's not quite right. That's because you know what that's supposed to sound like based on the vibration and the sound that's created. So the human body itself creates about 7.5 hertz when you're standing, 4.6 when you're sitting, and there's a measure of what looks like for vocal folds, which is different, obviously, for men, women, and kids. So the higher frequency that you get, or the higher hertz that you get, the higher pitch you're going to have. So again, the violin's at 440. And then just in comparison to what medicine has to deal with, is that an ultrasound is in kilohertz. And that kilohertz equals 1,000 hertz, which is 20 kilohertz for an ultrasound, or 20,000 hertz. So that's high frequency sound that travels through the gel into the body and collects images through those sound waves that then bounce back. Again, why is that important to us? Well, anybody who's had an ultrasound knows why that's important, because you're trying to, I always was fascinated by the ability for sound waves to create pictures for us. And now we know why and how that happens. One more slide on the science. So it's like I said, not rocket science. The fast and kind of exciting music tends to increase heart rates. It kind of brings your blood pressure up a little bit. You feel more excited, more intense. The experience is what it is. I mean, you wouldn't go to a Fast and Furious movie and have Moonlight Sonata playing behind it. That would defeat the purpose of that car chase that's taking place that you're watching. But in the same vein, a slower paced, calm music can affect your blood pressure, bring your heart rate down, relieve stress, help with the pain, help with the anxiety. Not necessarily cure it, but it does absolutely help. And so humans are very sensitive to the lower and higher frequency. So we tend to use it as a form of torture, actually, because you probably have seen a movie, maybe you haven't, but hopefully if you have, you've seen movies where they use it as an interrogation type of method, because heavy metal, hard rock music, constant, consistent frequency, that heavy vibration constantly is a torture to your mind, your body. It can't take on that much stimulation all at once. That's why it's considered a form of torture. But in the same vein, you can do the opposite. We can do more calming, more healing, more thought-provoking type of music to bring on what the outcome is that we want from the type of medicine that we're trying to provide. So, and then also there's some preconceived notions about what music therapy and certain diseases do in this particular case. So in this one in particular that I can think of, in the movie The Accountant, there's a character who's autistic. And so they perceive him every night before he goes to bed that he's listening to heavy metal music, and he is constantly strobe light and the whole thing going on. And everybody kind of perceives that that's what you would do in music therapy for somebody who has autism. That's not true at all. That is, in fact, it could be something that they like to do, but it's not necessarily the way you would treat autism in perspective. So, so a little bit of Hollywood there. You got to take it all in a grain of salt. So there's some clinical investigation and research studies. There's a bunch. There's a whole bunch of them, and that lend to the evidence-based medicine that goes along with music therapy. This one in particular I liked because it had a decent number of people enrolled, and it actually had a cultural base to it as well. So taking into consideration the culture of the patient that you're trying to treat at the time, based on the kind of music that they would be born and raised with, or maybe have been accustomed to their whole life. So this one came from the International Journal of Radiation Oncology in May of 2017. And like I said, there's a bunch of them. Just Google it, you'll find a ton. But the impact of music therapy on anxiety in cancer patients undergoing simulation for radiation therapy. So 78 patients were enrolled, 39 with music therapy and 39 without music therapy. So they went through the process having no music, no no connection to music, not just music therapy, but no therapeutic music. And I'll explain the difference in a minute. But 38 had breast cancer, 40 had head and neck cancer. There were 27 males and 51 females. And they did all of this study by a questionnaire dictating the scoring for fear, anxiety, and stress. So the conclusion was that music therapy significantly lowered the patient's anxiety and distress during the procedure. And then obviously the recommendation was that they integrate culturally centered individualized music therapy as an effective tool in reducing stressors related to procedures. So it's more than wearing the headset or the headphones and listening to music when you go in for a CT. There's a bit more that goes to all this. So they also had similar studies that showed music therapy can boost the immunity by enhancing antioxidant production. So another way to measure whether or not music therapy is actually working, and are we able to help these patients fight off what might be happening? And then they studied the level of vibration and how it increased the body's responses to pain as well. So very similar to the response that we might get from a pharmaceutical at that point. So all great studies. I wish I could go on more, but my kids would kill me. And there's a lot that everybody can read too. Everybody can read what I just read. So, clear definition of what music therapy is that they have the clinical evidence-based music interventions to accomplish therapeutic relationships by a credentialed professional. It must address the physical, emotional, cognitive, and social needs of the patient. So those doctors do things called review of systems when they see a patient in clinic. This would be a music therapist's review of systems, so that they have some idea that they have covered all their bases when they see that particular patient. So true music therapy, an example of that would be when Congressman Gabby Giffords used music therapy to regain her speech after she was shot in the head. So she has done very well with music therapy in Arizona. So there's therapeutic music, and then there's music therapy. So what is therapeutic music? Definitely worthwhile, but not necessarily music therapy. So things that you have and we should have or can have or will have, but bedside musicians. I've done this before many times, or musicians that go to nursing homes and play during dinner or just as an impromptu concert. Those are bedside musicians that are great for the body and the soul, not technically music therapy. But a piano player in the lobby of a hospital or a health facility, therapeutic music for sure. It's a calming effect when you walk in, plus it kind of classes up the joint a little bit. So, and Dr. Deming, I would be happy to help fundraise for a piano in our lobby because I'm in the same building you are, and I want a piano out there so bad. I'll just go for lunch and go play.
All right, let's do it.
All right, sounds good. Choir singing on a patient floor during the holidays. Again, therapeutic and very, very important, but not necessarily music therapy. The music you listen to during a CT with the headphones, I think I've had 3 CTs in my whole life. And the first time I had a CT, they said, what kind of music do you want? And I said, oh, I don't know, I'll listen to the 80s. And I got a lot of the music I liked. My CT went pretty well because I hate confined spaces. And so I'm like, I'm all right. I've got good music. I'm fine. The second time they didn't ask, I forgot, I panicked. I get into the CT and there's no music. There's nothing. I have headphones on to take away some of the sound because it's so loud, but that was the worst CT in my whole life. And then the second time I got music, they said, what would you like? I said, the 90s. And I should have thought differently about that because I got some music that I didn't really want to hear, but at least it was music and it kind of drowned out the sound of the CT. So again, therapeutic, very important, but not necessarily music therapy. And so a person with a brain injury who listens to music before going to bed, that's therapeutic for them, but not necessarily music therapy. And all very worthwhile, should continue, just not a part of the clinical process that we're talking about. So a little bit of history, just a slide about it. It dates back to Plato, Aristotle, and some of the writings there. It goes that far back. And then for our perspective, World War I and World War II had a bunch of veterans that went around as musicians and visited hospitals and played and sang for the sick and the injured. Eventually, those musicians became so popular that they were eventually hired by hospitals and healthcare facilities to perform for all these patients, not just the soldiers. So out of that grew a curriculum that had the first music therapy degree program at Michigan State in 1944. So I became aware of it in college. I've had a passion for it ever since. I paid attention to Colorado State for a long time because they've got a great program there. I took a few impromptu classes in music therapy out in California. And like I said, my life has taken me different places and I've not been able to kind of connect with my job, being able to keep my job and go to school. So this program at St. Mary's of the Woods is really, really important for music therapy because it's distance learning now. So finally. And Dr. Demme, you can correct me and tell me what your plans are a little bit, but I know we talked before about this multidisciplinary type of care with incorporating music therapy into it from the standpoint of the cancer center. And those are some things that in cancer patients, this would be the motivation to try and alleviate some of their pain, stress, anxiety. We want to promote movement when they can, relieving muscle tension. If music's anything, it's motivating or can be. And then of course, some of the studies said the antioxidant production and just the endorphins that are created sometimes give you a natural high rather than trying to do all the pharmacy work. So I really hope that this grows significantly, with or without me. I love it, but it would be a huge boon to this area if they had music therapy at a cancer center. So some misconceptions about music therapy. The patient does not have to be musically inclined at all. You're going to see a video in a few minutes, just a real quick video of a music therapist actually doing her work. And that'll give you some idea of what that looks like. One style of music is more therapeutic than the other. That's a misconception. That's not necessarily true. What's good for one is not always good for the other. So you have to kind of learn as you go. That's why you need the professional to help you through the process. Another misconception is that individual patient preferences play a role in the success of the treatment. So, hey, I really like this music, so my outcome is going to be much better than somebody else's. Not necessarily the case. And then patient goals determine the music concept and the treatment that is utilized. Not necessarily true as well. Some patients may say, I love to play the drums and I get a lot out of my group therapy that I go to, but that doesn't mean that your patient goals are being met. So. All right, this is from MD Anderson Cancer Center. I just pulled it off. Anybody can watch this too. But I really like this woman that works there, and she's a music therapist full time. And this is just like a 2-minute video of her doing her thing. Yeah, I think she does a fantastic job of bringing out that ultimate connection between music and whatever is taking place in that patient's life at that time. Yeah, it's really, really important. So a few things that music therapy does. We talked about the review of systems that a music therapist would do, but in that process, they have 4 different ways of doing it for the most part. And one of them is clinical improvisation. So a music therapist might go into a patient's room and just start making music together, or the patient comes to the therapist's office and they make music together. It's just an exploration and an improvisation opportunity. And then there's active listening to the music. So the patient is there, present in the moment, trying to get all the distractions away by listening, actively listening to the music. That's another way. Active playing is not just listening now. You're going to be actively engaged with an instrument, and it could be anything. It could be a song bowl. It could be a guitar. It could be the piano. It could be anything at that point, or just singing if that's what they want to do too, because the voice is just as much as an instrument as everything else. And then the 4th thing that a music therapist kind of works on too, depending on the level of therapy they're trying to do, is some songwriting. Some people actually write down poems, lyrics, and they can bring out some of their anxiety and their stressors by writing about it. And we've been told that many, many times over the years when things get crazy to start writing something, write it down and put it out there. It's freeing. Okay, so I'm interested in this. I'm going to do this. If there's anybody else out there, I would be more than happy to help give them some information if they want. But this is the basic requirements for the distance learning program at St. Mary's of the Woods, and to become a music therapist, a board certified music therapist. So you need a bachelor's in music therapy or music from an American Music Therapy Association approved college or university. Morningside University is one of them. You need 1,200 clinical hours of training, and then music therapy board certification. You're going to sit for those as well. And like I said, St. Mary's of the Woods in Terre Haute, I'm not paid to say anything about them, not at all. I just know that they are the only distance learning program so far in the nation. You do have to go there periodically to visit because there's some hands-on that you need to be present for. But other than that, it is all distance learning at that point too. And I think it's a great program. I'm so glad they're doing it. So music's universal. I mean, it's a cliche, but it's true. And then music is the key to learning and now healing, in my opinion. So I thought maybe if we had questions or Dr. Demi wanted to talk a little bit, I wondered if this was going to play and just play this cute, soft music behind it. I love these nature, as if you couldn't tell, these nature videos with all this beautiful piano music behind it. I know it's probably digital piano music, but I love it. I absolutely enjoy. And this is on for an hour and 30 minutes. It's supposed to be a screensaver, but.
Well, thank you, Alicia.
You are welcome.
So I love the way you made the distinction between music therapy and therapeutic music, or you know, because there is a real distinction, and a lot of what I have incorporated so far has been more just incorporating music in support surroundings. So for example, we do spin class. I mean, I cannot imagine doing spin class without music playing. So here we go. Right. Here's my playlist. Let's just go. just one little nugget from my playlist here, and see if that doesn't get you on it.
Yeah.
Okay. I mean, the sweat's already getting going here. So can you imagine the difference between doing a spin class without music and having something like this going?
Yeah.
And the way that it just kind of creates a mood, a space.
Right. So your body rhythmically gets in tune with that music. So move as fast as that music's going.
Yeah, it not only helps psychologically, philosophically, but it does really help energize you. Now, in a class of 30 people spanning maybe 5 different decades of age, not everybody is turned on to every song that I might play.
Right. Very true.
The other thing that I would say is obviously in relaxation, and you pointed to that. So we bring music into a patient, let's say, is going to have an hour-long cyberknife treatment. They get to actually choose the CD that they want loaded that's going to be playing in the room, or somebody is having something done, with a face mask on, and you just want to soothe them. I would say another thing that is kind of fun is we sometimes, and now that we all have, an automatic jukebox with every piece of music ever written in our hands, it's fun when getting together in a group setting of fellowship to just, everybody go around and just, what's a song that's tripping your trigger or you want to share with somebody? And it might be something that is, puts you in a mood, or part of my book club was doing books around bias related to cultures and sort of this inherent white supremacy. And we started introducing songs of, Strange Fruit by Billie Holiday, and songs that were bringing in the discussion. So another way that we bring music in. And I would say, similar to reading a novel, sometimes, and I probably shared with you that I like musical theater, and sometimes just listening to the whole soundtrack of a musical that goes through the ups and downs, and the plot is kind of like reading a book, but it can take you through laughter and tears, depending on what you're listening to. So those are all.
I've probably done about 50, maybe more shows, musicals and straight plays. And the last one I did before the pandemic hit was actually A Christmas Story. I played the mother, and the mother has 2 beautiful solos in there. And the last solo she does is where she thinks that her son is in trouble with the dad because he swore, and so the younger boy hides under the sink, and there's this tender moment. And I found myself tearing up every time I sang that song, because I thought about my boys and what I would do to them if they swore. No, but it was just kind of a tender moment in the whole show. It kind of takes you every single time. And I probably did that show 30 times, and every time it got to me. Yeah. You just don't know how music is going to affect a certain phase of your life until you're starting to live it, and that music is there for you.
Yes. In the video you showed, there also was this circle drumming. Yes. And you see that being used in different settings. Can be a bit of a team building. It's obviously got the mimicking of the heartbeat and sort of the synchronizing of moods around the room. And have you ever done any group drumming, and what more would you say about that?
Yeah, I have done that before, pretty much in my music training, or if we're teaching a class at the theater. There may be some, especially for younger kids, because it gives them an opportunity to be a part of something while they're learning what it actually. And then I think too, group singing I've participated in as well, which is incredibly important, because it's the one instrument that you control physically in your own voice. And you can see people learning how to match pitch or match tone, or try very hard to sound like one voice. Somebody else be singing, a whole group will be singing, they'll be like, wow, that sounded like one voice. That's because they, as a group, are learning to support each other and have the same timbre, same tone, same pitch. And that's the whole concept of healthcare. Trying to be supportive in healthcare is the same idea, that we're all trying to support each other. We'll all match pitch. Right?
And you went a little bit into kind of the clinical aspect, and I know that you're in the process of becoming a music therapist. My understanding that once you get into that, it's kind of a combination of music, but it's also learning psychotherapy and principles of counseling, and how do you maybe more like on a one-on-one basis bring music into a counseling session that might have a particular goal related to some cognitive, behavioral, or mood type of intervention.
Right. That's why it has to be a certified professional. At some point, you'd sit for your boards at that point, because it's a blend of three: psychology, medicine, and music, in order to get the desired outcome from a particular patient visit, or, like I said, it's more than a bedside musician, because you can come to anybody's bedside and sing for them and hold their hand and be kind and considerate and loving. But that's not necessarily the clinical aspect of it, because as a music therapist, you're going to want to delve into what's really going on here and use music in the process. So absolutely, it has to be those three things. That's why it's going to take me 2 years. Mm-hmm. Program. Yeah, I'm no spring chicken, but I'm not going to give up.
Okay, so let's do, we've each got, well, you've got it. You've got the piano with you, so you don't
I do. So wait, whoa. I see. So I did some research before I did this. And Chris said he would help me. So I don't, we picked out a song for you to sing for us.
Oh, okay.
You kind of put it in the chat already. So I pulled it up, and I think I pulled it up in a key that's decent to sing in. So, okay. Yeah. So I know you know this.
Okay.
There's a bright golden haze on the meadow.
There's a bright golden haze on the meadow. The corn is as high as an elephant's eye, and I think that it's growing right up to the sky. Oh, what a beautiful morning. Oh, what a beautiful day. I've got a beautiful feeling. Everything's going my way. I'm not on pitch at all.
Yes, you are. Yes, you are.
You sing and I'll sing with you. I'm better at accompanying.
All right, let's do it again.
Okay.
There's a bright golden haze on the meadow.
There's a bright golden
haze on the meadow. The corn is as high as an elephant's eye, and it looks like it's growing right up to the sky. Look, what a beautiful morning. Oh, what a beautiful day.
I've got a beautiful feeling. Everything's going my way.
That's it.
Thank you.
Yay, that was excellent.
Yeah.
So they said anything Tina Turner. And I thought,
yes. You're the best. You're better than all the rest.
Yeah.
You're better than anyone I've ever met.
That's wonderful. And then they said he liked show tunes too. And they said, but his favorite is "Oh, What a Beautiful Morning." And I'm like, Oklahoma, of course. Yeah. Yes. I didn't pick Music Man because it is Iowa, but that's it.
Yeah. So the thing behind that song is that whenever I'm outside and running or cycling outside, that song, if I'm in a good mood or it's a beautiful day, that song just instantly pops. And I don't know whether it brings on my mood or my mood brings that song on, but it just spontaneously erupts. And
did you grow up with it? I mean, where did that come from?
Probably the very first musical I ever saw in college, the college production of Oklahoma. So that was,
awesome. Yeah. And I think those songs that over time have a real spot, a special spot in our heart, they came from somewhere. Mm-hmm. yeah, for sure. And there's always those songs too. They're like, oh yeah, that reminds me of my ex or whatever.
Yeah, there is definitely songs that take you back to a time and place, whether it was prom or, you know, a concert you saw in college. So how about we go out with you singing a song, one of your favorite songs from either contemporary or a musical you were in, or anything you want to take us out on?
Let's see, what do we want? Let's see.
Hey, Carol.
Lean on me when you're not strong, and I'll be your friend. I'll help you carry on. Oh, it won't be long till I'm gonna need somebody to lean on.
Beautiful, beautiful.
There's all kinds of songs that go on forever and ever and ever. Yeah. Mm.
Well, Alicia, this was so much fun. I'm so glad that you're on the team. I can't wait to learn more from you and incorporate your talents and your budding profession into our new innovative cancer center. So thank you.
Thank you so much, Dr. Deming. It is my honor and my pleasure to meet you and get to know you. So I'm grateful to be at MercyOne. I really like it here, and I'm glad to be home near family. You can't be.
Great. Well, you have a happy Easter this weekend as well.
You too.
And, Chris, are you there? We'll turn it back over to Chris, who will close us out for the session. Thanks, Alicia.
I was very glad that I didn't get called on to sing, because I could sing without my mic on. It was perfect. Well, thank you. This was I've seen it in action, and it really does work in calming people, and it's medically proven to be successful. So great to learn more about music therapy. So this was recorded this evening, and it will be on our YouTube channel at Above and Beyond Cancer, along with all the other recordings of these cancer education series. It is also present on the MercyOne Cancer Education Series website, so webpage. So we are encouraging people to not only view this one or encourage your friends to do the same, but please view all of those that we've been able to capture in the last 50 weeks or so that we've been doing these Zoom webinars. So next week will be a little bit different in that Dr. Deming will invite anyone who would like to join him out at the MercyOne Health and Fitness Center in the conference room where we have traditionally done these in person. And the speaker will still be captured on Zoom. So Dr. Deming's screen will just be broadcast so that everybody in the room will be able to watch what he's watched, just like you do at home. So then you can join Dr. Deming for his indoor cycling class, and followed by smoothies. So it should be a nice way to sort of combine what we've been doing relative to the pandemic, but yet with social distancing and mask wearing out at MercyOne Health and Fitness Center, you'll be able to join Dr. Deming in person. So
we'll get to hear that playlist then too, right?
Yes, and very heavy on Tina Turner, I do recall. Yeah, so it will be great to see people in person next week. Please register through our Facebook page for that. And Alicia, thanks again for your entertainment and for your insight. Very informative. We'll see everybody next week.